So without further ado, let's start.
Assalamu alaikum, everyone. Can everyone hear me and see the screen?
Yes, we can see it and we can hear you as well.
Assalamu alaikum, everyone. I'm Dr. Fatima Farhan. I'm a graduate of King Edward Medical University, and I graduated in the year 2018. And I'm currently working as a second year resident in the Department of Hematology at Khan University Hospital. So, first of all, I would like to thank Osama for giving me this opportunity to guide our juniors and basically our third year medical students and those who have recently graduated regarding whether how they can pursue their career in pathology. As even during my time when I had planned to pursue my career in hematology, and I had been facing this issue that where to get the proper guidance and what is the scope of pathology residency in Pakistan. As people usually I've seen that there's a really less trend of people pursuing pathology, mainly because of the reason that people think that it's a boring field and there's no such clinical exposure. So basically, this initiative was taken to give this medical students and the fresh graduates a good overview regarding what pathology looks like and how we work as a pathology resident in Pakistan. So now I will begin. So I would like to welcome everyone who who has joined this seminar, and all those who are planning to pursue their career in pathology and those who are preparing for FCPS Part 1 in pathology as well. So basically, everyone thinks that pathology is just a branch of MBBS and just a basic branch that has not a important diagnostic value, but it is considered as one of the main uh, backbone diagnostic fields, along with radiology in diagnosing important diseases like cancer, hemophilia, and various other hematological diseases. So it's quite an important field. And here you can see there are so many words like diagnostic, branch, autopsy. All of these words, they are, if you look closely, they have a huge depth and they are quite closely related to this field of pathology. So pathology is that branch which no one can ignore, because starting from the patient's CBC, we make the diagnosis, and all the clinicians as well as the medical specialists rely on our diagnosis. Uh, then whenever a patient has anemia, they ask us that what is the cause. Whenever a patient has thrombocytopenia, they ask us to evaluate the patient and see that why the patient is having thrombocytopenia. And they then advise the medication and do the further management on the basis of our opinion as well. So our seminar is basically focused on giving a general and a very basic overview, since our audience not only comprises of the fresh MBBS graduates, but some of you might be third year medical students. Some of you might be those people who don't know even basic concepts about what hematology residency is, and how pathology residency looks like, and what happens in the life of a pathology resident. So, just giving a brief overview, what is pathology? What are the main branches of pathology? What is hematology, and what areas do we basically cover in hematology? So, this would be my main focus in this seminar. So, as you all know, that pathology is a study of disease. It is a bridge between science and medicine. And as I previously mentioned, that it is a very important aspect of patient care, starting from the diagnostic testing and treatment advice. And we basically use uh, advanced technologies like we use automated um, analyzers for flow cytometry that help us in making a diagnosis. So, who basically works in pathology? Pathology is basically comprised of a team of pathologists and technologists, and their job is to study the samples from a person's body. Uh, in our field, that is hematology, we study the blood samples and every aspect of the disorder relating to blood samples, whether it be related to the hemoglobin, whether it is related to white blood cells, or whether it is related to platelets or any other coagulation disorder. So we study every aspect of blood sample. And our team is basically comprised of pathologists and technologists. So, why pathology is important? Basically, all the clinicians, whether it be surgeons or medical specialists, they look to pathologists and our consultants for advice on the nature and seriousness of a patient's illness, making sure they get the most appropriate treatment. For example, if you receive a patient who's spontaneously bleeding, and you don't know what is the main reason behind it. So you are always going to ask a hematologist to evaluate the patient as well. Maybe that patient might be a case of hemophilia which has not been diagnosed yet. So the hematologist will order relevant investigations to be done, and then a proper diagnosis would be made on the basis of those tests, and a proper treatment and management plan will be devised. And for example, in hospital settings, you might have heard there is a frequent outbreak of MRSA or any other antibiotic resistant or microorganisms, and you don't know what is the source, and you have to contain that outbreak so that it does not spread to other patients and to your staff. So you're always going to consult a medical microbiologist who is going to check from the source, that what is the source and what is the underlying cause of this outbreak. And this is how um, uh, multidisciplinary approach is then established on the basis of this thing, that not only hematologists do not work solely. In fact, all other clinicians rely on pathologists, may it be microbiologists and hematologists, for further diagnosis and management of patients. So, in Pakistan, pathology is further divided into five main branches. One is chemical pathology, the other is hematology, which is my field. The third is histopathology. Fourth is microbiology, and it includes both virology and immunology. And the fifth one is molecular pathology, which basically deals with all the genetic tests that help in confirming the diagnosis of patients. For example, there are certain patients of leukemia that have different prognosis related to their cytogenetic abnormalities or different mutations. So it is basically the molecular pathology department that there are certain specialized tests. For example, in patients of chronic myeloid leukemia, we order a test that is BCR-ABL translocation. So this is the main test that confirms that okay, this is the patient of chronic myeloid leukemia. So such type of tests, they are done in molecular pathology. Chemical pathology basically deals with all the tests, biochemistry profiles, for example, LFTs, RFTs, the hematology, which is my field. This basically deals with all the diseases that are related to red blood cells, white blood cells, platelets, may it be leukemia, lymphoma, anemia, thalassemia, uh, whereas histopathology basically, deals with the diagnosis of patients on the basis of their biopsies, For example, if the patient has got a lymph node biopsy done, so the histopathology department will, make a diagnosis on the basis of that patient's biopsy. And microbiology basically deals with the diagnosis of patients that are established on the cultures that are obtained from the different body sites of the patient. For example, the patient we have received, blood cultures, a sample for blood culture or pleural fluid sample, and we want to check that the antibiotic resistance or any infective organism in that sample. So microbiology deals with that. Okay, so now just giving you a brief overview of how you can pursue pathology uh, overall. In Pakistan, you can pursue pathology by first giving FCPS Part 1 in pathology. Whereas in UK, you can pursue pathology residency by giving either lab or FRC path. FRC path exam is basically you get eligible for this exam after you have done your 2 years of training in pathology residency, and you can do a residency from anywhere in the world. But the compulsion for this is that you have to have done by your 2 years of training, then you are eligible to sit in this exam. If you are planning to pursue pathology in USA, you would have to get USMLE, and without that, you cannot enter into the residency program. So my main focus would be on how you can pursue pathology in Pakistan. So if I talk about the hematology institutes, there are there are 5, 6 institutes overall in Pakistan. And all of these institutes, they require that you qualify part 1 in pathology. You have passed this exam, and then you can, enter the residency program. Since I'm currently working in our hospital, so they had a requirement that you have to pass their residency test, which is basically a separate test other than the part 1 in pathology. They take their own residency test, and after, if you have cleared the test, they will call you for interview. And after you have been selected in the interview, they will, select you in their residency program only if you have passed your part 1, FCPS part 1 in pathology. If you, even if you have passed their AQ, even if you have passed AQ residency test and qualified for the interview as well, but you had not passed your FCPS part 1 in pathology, they will not select you for the residency program. So in my institute, these 3 criteria were important to get into the residency program. Whereas in other institutes, I don't think they don't, any other institute in Pakistan, I don't think they take their residency test, but Khan takes the residency test. So this is how you can enter into the residency program. So now coming to the main focus of our seminar, that is what it basically is hematology. Hematology, uh, as you all know, it's basically involves the diagnosis and management of wide range of benign and malignant disorders of red blood cells, white blood cells, platelets, and coagulation system. And you must have, seen such patients in your house job or even in clinics, or even heard of the names of these diseases in your, read some about some of them in your books as well. And the most commonly encountered diseases we have seen are anemia, hemophilia, leukemia, lymphoma, multiple myeloma, sickle cell anemia, thalassemia, and morbid Crohn's disease. So these are all basically the disorders that are related to hematology. Okay, so basically, what is the role of a hematologist? Um, After you have done your, even during a residency, and even after you have become a consultant, what is our main basic role? Our role is to, first establish the diagnosis of patient on the basis of the patient's symptoms and the relevant investigations. And the relevant investigations are complete blood count, examination of the peripheral blood smear, which is a very important aspect in hematology. Um, there are some diseases that cannot be, diagnosed without this examination of the peripheral blood smear. There are a lot of diseases that are diagnosed solely on the basis of morphology of white blood cells. For example, there is a type of leukemia that is acute promyelocytic leukemia, if you all have heard about it. This type is basically diagnosed on the basis of morphology. You basically see that normal promyelocytes. And you can also, confirm all these diseases by ordering genetic tests as well, but there are some diseases like this one that are confirmed mainly on the basis of morphology. So examination of the peripheral blood smear is very important because we see the morphology of red blood cells, white blood cells, and platelets. And there are a lot of things that are missed on the CBC report, but when we examine the peripheral blood smear, then suddenly find out that okay, there's a blast cell in this patient's peripheral smear, and there are like some patients they have thrombocytopenia without any reason. When you examine the peripheral smear, you see that oh, there are a lot of platelet clumps. So like this is the reason why the patient has been reporting low platelet count. And the physician is, worried as well, like what's going on with the patient, why the patient has low platelet count. And he's ordering a number of tests. And, you can't find out the problem that when we examine the peripheral smear, we see that, oh, okay, the patient's platelet count is low either because of platelet counts or sometimes we even identify a malarial parasite, which is basically uh, you know, detected on the peripheral blood smear. So you find out a number of reasons for the patient's underlying clinical conditions solely on the basis of examination of the peripheral blood smear. Other tests are coagulation tests. You might have heard of PTA, PTT, INR, uh, and bone marrow biopsy, which is a very important test for establishing diagnosis of all the leukemias and lymphomas. All those patients who have either, got their lymphomas diagnosed on lymph node biopsy, they have to have their bone marrow biopsy done for staging. And without this, you cannot, start the treatment if there is patient of lymphoma and his bone marrow is also involved. So, you have to advise a proper treatment plan for that patient. Then there are just genetic tests, which I have told you that there are certain leukemias and certain lymphomas whose prognosis depend on the type of mutations. So we order genetic tests as well, to confirm the prognosis that whether this patient would be of good prognosis or bad prognosis, and what type of treatment we should give to the patient depending on that mutation. And the other main aspect and the other main role of the hematologist is to, devise a proper management plan on the basis of the diagnosis. The management could be blood transfusions, in patients who are anemic or patients who are hemophilia or any other bleeding disorder. Proper medications, for example, iron therapy for those patients who are anemic, chemotherapy for patients with leukemia and lymphoma, radiation therapy, stem cell transplantation, which is very important thing in pathology as we first, monitor the patients of leukemia and lymphoma that if the age group is also a favorable one, if the patient is young and he's responding well to chemotherapy, then he can be a candidate for bone marrow transplantation. So this is the main crux of the hematology. What we basically deal with uh, uh, all these things, basically deal with all these things on a daily basis under the cover of hematology. So hematology basically has two things, and there is a general misconception amongst the people that hematology is just lab related. You just, sit the microscope and just you are just examining the slides and that's it. You're not doing anything else. But this is a wrong misconception, as I've told you that we uh, establish the diagnosis of patients on the basis of their symptoms as well. We see the patients in clinics as well, which covers the clinical aspect of hematology. And after, going through all those lab-related tests, after ordering all the relevant investigations, we then come to a conclusion of a diagnosis, and then we establish the treatment, the relevant treatment for that patient. So we deal with the clinical part as well. So our lab part is basically related to the investigations that we ordered. Uh, the main thing is the morphology. We examine the morphology of all the cell lines in a peripheral sphere, and I will be explaining all these subsets in further detail in my next slides. And there are certain specialized tests. For example, for diagnosing patients of thalassemia, we order a test that is called high performance hematography, that is specifically designed to, detect the abnormal hemoglobin in the patient's blood. Uh, the coagulation part deals with all the, tests that are related to the bleeding disorders, for example, PTA, PTT, INR, factor SA, the patients who are of, having multiple clots. Then we order the specific panel of it's called thrombophilia screening, which includes protein C, S deficiency, and antithrombin 3. And one of the main, areas under hematology is the blood bank. It's very important part of hematology, as the hospital's main supply of blood, and every query related to the dispatch of blood products, and the till the blood is transfused to the patient, everything deals with this part. So this one is very important area of hematology as well. And the clinical part deals with basically the treatment. We advise chemotherapy and other medications on the basis of the patient's diagnosis. So explaining one of the areas of hematology one by one, the first part, that is the morphology. We examine the peripheral blood smear and correlate the indices that are seen on the complete blood count with the morphology that is seen on the peripheral blood smear. We do reporting of bone marrow aspirate and refined biopsy, and the main diagnosis of leukemia and lymphoma is basically not preferably lymphomas, but all the leukemias are diagnosed on the basis of this reporting of bone marrow aspirate and refined biopsy. Uh, the other specialized tests we do are HPLC, which is called high performance hematography. This test is basically done to diagnose patients with thalassemia. There's another test by the name of a spotted fragility. This test has become obsolete in many labs, but we are still doing it here at our fund. So this test is basically it's a screening test, but not a confirmatory test for diagnosing patients of hereditary spherocytosis or eleptocytosis. And then we have flow cytometry as well. This is an important diagnostic test and considered one of the gold standard tests for diagnosing patients of any malignancy. So I just wanted to give you a brief overview of how we correlate the morphology with the indices of the CBC that are seen on this report. So peripheral smear usually looks like this. There are they're of a normal patient, of a normal person. There are red blood cells, white blood cells, and platelets. And this is basically a report of a CBC report of a patient. And it basically, shows all the indices, hemoglobin, hematocrit, and CBMC, WBC neutrophils. And we, not only just, see the values and make the report, but we also correlate all these things with the morphology as well. These two things have to be correlated, and then we, make the diagnosis or give the comments on the peripheral group. So this is what a peripheral smear looks like. Here you can see these are all the red blood cells. This is the neutrophil, and these are the platelets. And whenever we see the peripheral smear of a patient that is suffering from disease, for example, In this picture, you can see that this is the peripheral smear of a patient with sickle cell anemia. Here you can see, the distorted morphology of red blood cells of the sickle shape. So, this thing is not, it cannot be missed at all. When you see this distorted morphology, then, you make confirmed diagnosis that, okay, this patient is from sickle cell anemia. So here you can see that how much important the morphology is, and basically what importance, huge importance, there's a huge importance of the peripheral blood stream as well. So you cannot ignore this. So this is a peripheral smear that is showing all the normal white blood cells, and here you can see compare the uh, the abnormal white blood cells with these normal white blood cells. So these are all the glass cells. And this is a smear for patient very frequently. So this is another test is HPLC that is used for diagnosing patients with thalassemia. The report looks like this. Basically detects the abnormal hemoglobin and always correlate this with the morphology. So here you can see that this does not seem like a normal morphology. Here the red blood cells are fragmented. So we always correlate the two things. So the third aspect of hematology, that is the correlation, um, basically deals with tests like PKPTTI and our factor assay that can be used to diagnose patients with hemophilia and factor deficiency. And we do the platelet aggregation studies that help in diagnosing patients with elasmin and thrombocythemia. So the main and the last component of the related to the lab related part of hematology, that is the blood bank. So this is one of the main, important parts of the hematology department in a hospital, as we deal with this, we deal with everything starting from the time when a donor comes in our blood bank and donates the blood. First, we take a detailed history of the donor, and then if we see that the donor has fulfilled our criteria, then we take the blood and we perform blood grouping, cross matching, and prepare all the components from the whole blood, that is fat cells, platelets, fresh and plasma, and cryoprecipitate. Then we do the antibody screening and identification, as this thing is very important in pregnant patients, those who have a suspicion of hemolytic disease of fetus and newborn. So this is very important. This helps in diagnosing if the patient is going to have HDFN. So whenever there's a patient who has been transfused and there's a transfusion reaction, either the patient has allergy, has developed symptoms of breathlessness, the concerned staff documents that reaction and sends us the whole workup, and we do the whole workup and investigate that what was the underlying cause. And we also deal with issuing and dispense of not only packet cells or all the components in whenever they are required for transfusing any patient in the hospital. So the clinical part uh, related to the hematology is basically we see patients in our clinics. We prescribe the medications on the basis of their diagnosis. We make a decision for their chemotherapy and whether they are candidate for bone marrow transplant. And we see patients and follow-ups and check their prognosis and the response to treatment. And in patients, we see consults regarding various hematological queries. There are many patients who have inpatients get thrombocytopenia or anemia, various reasons. So they always consult us and ask us to evaluate the patient and suggest the proper treatment plan. So this was all about uh, hematology and how hematology residency looks like and what we do as a hematology resident. So if there are any questions, we are most welcome to ask. I think we still have a few minutes left.
Yeah.
So if anyone wants to ask a question.
Thank you. It was very comprehensive view about hematology, and especially in Pakistan because it is separate residency here. Yes, we still have 5 to 6 minutes left, and there are some questions in the chat. I will post. I can ask them here. So Dr. Nayab asks, how is this different from clinical hematology after internal medicine if we see patients?
Um, Basically, clinical hematology, this has been introduced by CPSB in, I guess, 2011 or 2012. And the only thing differentiating clinical heme from lab hematology, which we are doing, is that the clinical heme residents, they only do, uh, uh, they first do 2 years in internal medicine, and then they do the 3 years in hematology, and they do all these things. They do all this stuff, related to lab and related to the clinical part as well. Their focus is more on the clinical part. They see patients in wards, and they also have calls in our hospital. Clinical residents also have calls, 24-hour calls, and they and suggest treatment plan, and see the prognosis of patients. So there is not much difference apart from the fact that the clinical heme residents, basically they have done their 2 years in internal medicine, and in the remaining 3 years they have to deal with all these things related to lab and related to clinical part as well. But they do their focus is more on the clinical part. So they have mutations in our lab. Related to all these, areas, coagulation, blood bank, for a few months, where their main, the primary department is basically their ward, where patients with all the hematological malignancies are, admitted. So they're basically doing all the monitoring, and the treatment of all the patients is basically done mainly by them. And we do the lab related part. We see the peripheral smears and all the relevant tests. But we also do the clinical part as well. That is seeing patients in clinics, but not much as the clinical team residents do. So this is a big difference between us, the lab team residents, and the clinical team residents.
I hope that answered your question. It was a very detailed answer. And Josefa Sakib asks, I'm not sure if you have information about this, that in what year it is advisable to take an elective in AKU for pathology?
I would suggest that I think you can take elective in fourth year or third year. That would be more suitable. Basically, because you get introduced to pathology in third year, and you're just studying the related part, and not you do not know what is going on in the lab. So I think third year, fourth year would be better time to
Hmm.
get electives in it, or any other
Okay.
institute.
Okay. Kinza Junaid asks future options after FCPS in hematology.
Okay, so future options are that you can, work alongside with an institute, like for example, you can work in a hospital, or you can open your own lab. Most of the people, they get affiliated with a certain institute, and look after the whole department of the hematology, and mainly they look after the blood bank, all the queries related to blood banks. So you can, get affiliated with an institute as well, and open your own lab as well. That depends on you. And you can also do a FRC tag as well if you want to pursue your career abroad. You can also do that as well.
Okay, I think we have 1 minute left. I think we
Okay.
will sign out, but we will post answers to your questions there. But and goodbye, everyone. Have a great evening. But just before we finish, the last question you can answer it. Is it possible to do hematology and histopathology as a combined residency? I know it is as such in US, but for Pakistan, Fatma can answer.
In Pakistan, you can do hematology and histopathology as a combined residency. This combined residency can only be done in the USA, which is the APCP residency, in which you deal with all the pathology. But here in Pakistan, you cannot do both of these side by side. These two are totally different things.
Okay, I think that's it, and we just finished in time. And thank you, Dr. Fatma Farhan, for your time, and everyone else for joining. You can follow on our Twitter for more questions, and have a great evening. And we will see you next time, inshallah. Goodbye. Yes, there are some thank you messages for you. Yes. Okay. Goodbye, everyone.
Thank you so much.
Goodbye.